And look at what's happening with antiretroviral drugs here. We're understanding that there's likely to be a shortage in this country if measures are not taken. We'll be speaking to authorities who know more about it. But now we know that persons living with HIV in Ghana say they are at their wit ends as they say health officials have begun rationing the antiretroviral drugs that they give them. Now, according to the persons living with HIV, the quantity of antiretrovirals that they had to be given have reduced, and therefore they suspect that things may not be going well with the antiretroviral drugs. We are getting details of all of this story here on the show. We'll be speaking to the man in charge of that, Dr. Tremetria, as well as the president of persons living with HIV in Ghana, for us to have a beautiful discussion on that. I'd love to start with, first of all, the president of persons living with HIV, who will be joining us. But we have Dr. Tremetria joining us via Zoom. Now, Doc, I'm grateful to you for joining here. Good afternoon to you, Doc. Pleasure to have you. Kindly unmute so we can hear what you're telling us, Doc. Great.
Yes, can you hear me now?
Yes, I can hear you now, Doc. Okay. This is still the pause here.
Good afternoon to you and your viewers, and thanks for having me.
Doc, so let's start with the situation with antiretrovirals. What's the status of our antiretroviral retroviral drugs in the country now?
Honestly, I was quite surprised this afternoon when on Joy FM News, it was mentioned that we've run out of antiretroviral medicines and that health facilities are rationing the medicines. That cannot be true because we have enough antiretroviral medicines in the country. At least we have medicines that will last at least for the next 6 months. And so that, I don't know where that information is coming from, but I know that we don't have any situation that should, cause any anxieties among people living with HIV in the country.
So if a person with HIV is going for his or her antiretrovirals, what are the quantities that you give them?
Well, I like your question, but let me answer it this way. Every person is, especially the stable people on antiretroviral treatment, should receive 6 months amount of medicines that will last the person for 6 months. At least, if we cannot meet that amount, it should be not less than 3 months. So we are doing multi-month scripting now. And so we do not expect that patients who are stable will keep going to the health facilities every month for their medicines. Okay. But of course, those who have been newly initiated, they need to be monitored by the clinicians to ensure that there is no problem.
Okay. Doc, if you can still hear me, that's for stable persons. You're just talking about those who have... okay, so we've lost Doc there, but we'll try and rectify the line so that we can have Doc back on this conversation. But we have Elsie. Madam Elsie is the president of persons living with HIV in Ghana. Grateful for you to join us here. What's the status of your antiretroviral drugs supply? How many have you received recently?
It's a big thing, so I didn't hear what the last speaker, much of what the last speaker said. But so far as I know, from last month, our members are given 1 month supply of antiretrovirals when they go for their medication. When this happens, it is a sign that we are running out of stock. Especially if you are a stable client who has been receiving 3 months up to 6 months supply, and you get there, you are given 1 month. It is telling us that something is not, all is not well. Coupled with the fact that after we attended the meeting with the Global Fund, the country team, last week, and we got to know that we had the current stock level would go out, will run out in May this year. Then that explains why we are receiving the 1 month. We are being given 1 month because the hospital has to, the facilities have to manage the stock that they have. What if somebody tests positive and the person has to be put on treatment immediately? You can't afford to give people 6 months.
So what you're saying is that,
there's some. So the indication is that we are low. We have low stock level.
So what you're saying is that from February, your stable members or your members who are stable clients are being given a month supply instead of the 6 months that the Ghana AIDS Commission has just been telling us.
Between 3 to 6 months supply, yes. You are given 1 month if you are a new client, newly enrolled on treatment. Then you are giving just 1 to 2 so that you could return and they will know how it went with you, if everything was going on well before you are even given a bit more. But if you are stable clients and you've been receiving between 3 to 6 months supply, we are suddenly given 1 month, and all around, our members are saying they are given 1 month. Then it shows that there's a cause for.
How widespread is this phenomenon when your members who are stable are being given a month instead of between 3 and 6 months?
It is across the country.
Now I'm asking this question because
persons in every region who are on the lookout, and our point of our source is when our members go and they receive what they receive. I'm saying what is being given out to our members who go for their medication.
I was asking so because the Ghana AIDS Commission says that the boss said he was a bit alarmed when he heard the story today. It looks as though what he's trying to say is we are trying to paint a picture that is not. And that's why I'm trying to find out from you how widespread throughout Ghana is the situation that your members are being given 1 instead of 3 and 6 months of medical supplies.
Let me just go back a bit and give more information.
Exactly.
We were expecting replenishment of stock in the country. Midway in December last year. We're told that between the middle of December and the end of December last year, we would receive this consignment that we are expecting. Right up to now, right up to last week, when we were at the CCM meeting with the Global Fund team, and we had a representative from Ministry of Health there, what we were expecting in December has not arrived yet. So if we were to have that replenishment in December and it is not in, and we know that what is in stock, there will be stock out in May. Of course, we are receiving being given 1 month. If you add, look at the evidence. It stands to reason that we are running out of stock.
Who said that I mean, the consignment that we were expecting in December has not arrived yet. Who said that? Which authority?
Global Fund, who went to Ministry of Health, who went everywhere they had to go to get the information because we were getting frustrated. They went and did the check. And the debriefing we received, is what I am telling you now.
Okay.
The debriefing we received meant that the information was that we ran out of stock in May as we were sitting there last week.
Okay.
And as I am sitting here, we haven't heard that the stock that we were expecting has arrived in the harbor because they don't even know where along the line that amount, that the ARVs that were purchased for $18 million are. You can't tell whether they're in the high seas. You can't tell whether they are at the harbor and waiting to be cleared. We can't tell anything.
Okay.
So if we are going to, if the data shows that our stock level will take us up to May, and we haven't had the replenishment we were expecting in December, what conclusion should we draw when we are going to the facilities and doing this one?
So I want a bit of clarification here. So this 80 million ARVs that were imported have not arrived in Ghana, and so they are not part of the medication that are stuck at the airport, which Global Fund was complaining of last week. Is that it?
They are not part of it.
Okay.
And one thing I want to continue clarifying is that the media, you keep on saying that 200 containers of ARVs are stuck at the port. It is not ARVs. Those are malaria. Malaria, the bed net for malaria, the medications for malaria, the injectables for malaria, the test kits for malaria. They make up majority of the 200 containers stuck at the harbor. The ARVs we are expecting are not at the harbor. They're not among those stuck at the harbor.
They are not even in the country at all.
The information we got from Global Fund is that they have not, they can't be given any information about where that consignment, for which the procurement was made. The letter they saw was August 9th last year. They can't tell where it is along the route from where it was purchased to the harbor. If it was stuck at the harbor, we would know it's already in Ghana. But we don't have any information. And then we are receiving for 1 month. And now we know there will be stock out in May, given the current stock level. So what conclusions do we make?
Whose responsibility is it to import the medications and to track, the transportation of those medications or those ARVs into the country, such that the person is saying, we don't know where it is?
You see, if it was bought, if the consignment that was bought by Global Fund, they would know where it is.
Okay.
This was bought by the government of Ghana, by the Ministry of Health. And if they can't tell Global Fund with whom they had made that co-financing agreement, so who else will give the information? If they can't give that information to Global Fund, I can't say anything. All we know is that they can't track it. And all I know is that there will be stock out in May.
Wow. So if these ARVs were bought in August or on August 9, 2023, and we are in March, we are not able to tell where they are. Aside the Global Fund saying this, have you also contacted the Ministry of Health, and what have they been telling you?
Ministry of Health sat and told us, their representatives sat and told us things which didn't turn out to be what we expected. So you would understand if I say I'm taking what comes from them with a pinch of salt.
Okay, to help analysis, what did the Ministry of Health representative say?
What is the Ministry of Health doing?
What did the Ministry of Health representative say around the discussion that you had last week?
I don't know. I don't know. The rep came to the meeting and just listened and went away. They didn't say anything. But the information we received, the person did not say that information that were being given was wrong. He didn't refute the information we were receiving. So for me, then that shows that it's correct. But what I know is that the consignment they were supposed to have procured for us hasn't reached the country. As of last week's Friday.
So once we've been able to establish all these bases, we were speaking to Dr. Atuahene a short while ago before you came, and he's saying that, I mean, for now, he knows that they are supplying to you those who are in stable condition 3 months. He is disputing the fact that, one, they are rationing the ARVs, and two, the fact that, I mean, by May, we may not have ARVs in the system. What do you say to those?
Well, then I'll say he's also government, so government wouldn't talk against government. But we are civil society whose lives are at stake, so we would say it as it is.
You mean Dr. Atuahene is not opening up and being factual with Ghanaians, covering up the issues?
I am not saying that. You are saying he's not taking the medication. I am the president of the network of persons living with HIV. We have people across the country who are receiving their 1 month worth. We have a facility who hinted at the fact that they were running out last month, but can't talk because the authorities would not take it kindly. So what again should I? We are getting information, concrete information that our life-saving ARVs are not going to, that will run out in May unless we are able to get what is supposed to have arrived in December last year.
Oh, interesting. I hope we could get Dr. Atuahene again to put some of these questions to him, because if we imported $80 million worth of ARVs last year and we're not getting them now, then there are some more questions to ask. So Madam Elsie, I mean, if the Ghana AIDS Commission comes out to say that you're not telling the truth to Ghanaians, what will be your next line of action?
You put us on the same platform, then he will have to give me where he's sourced. And I also get all my people ready who have received one. I mean, there's no need for that. You see, the issue is that Dr. Atuahene may have information. And I sympathize with him because he has to go according to the rules. And he gets his information from from the data that is available at the Ministry of Health or National AIDS Control Program. As usually happens, we realized, and at the review meeting, so had IVCD review meeting that was held early this month in May, we realized that many of the facilities will record stocks that they receive, but they do not record stocks that are given out. Okay, so when you look at the stocks at their facility level, they have enough. That has been an issue. That was the main issue that was discussed. Many of the facilities don't have they are not linked onto the monitoring, or I've forgotten this thing. They are not linked to it. So they enter the information manually. And when they are busy, because data managers have been recalled and they have to see to clients and they at the facility and also record. This data, this information tends to pile up and they are not able to get to enter input the information that they have. So Dr. Chiahini may be linked to the system, okay, that generates that information. So the information he is getting there is not the true picture. And this was established even at the beginning of this month by the health facility and all that who came to them. That is an area of concern for them. So the stock levels that are registered are not what the reality. So I can't say that Dr. Chiahini is telling a lie because he received from where he's supposed to look at, which is not being fully inputted. The information, all the information is not being put on there because of barriers or, at the facility level. And it's not, it's internal things, it's the system. The system is not working as it's supposed to work. So that is his source of information. But my source of information is from our own people who are taking them.
All right.
I have a little boy here who I had to tell my daughter to take to the facility for her medication. I have 3 other people who are staying in my house I have to take in. They went for their medication. They were given 1 month.
1 month.
And across the country, people are given 1 month.
Okay. All right. Madam Elsie, I am grateful to you for joining us here. We'll still keep an eye on this particular developing story because to hear that we've imported some $80 million worth of ARVs and we can't find where they are, that's a matter of concern. We'll be reaching to the head of the AIDS Commission in Ghana, Dr. Chiahini, to really find some answers. We started with him, but the line dropped along the line. We'd want to find out from him where are these $80 million worth of ARVs. And now the people living with HIV are saying that when they go to the hospital, like he said earlier, they have to be given not less than 3 months of medication for stable persons. Why are they being given 1 month? And what is he picking, from the ground as well? Now, Madam Elsie has made us aware that if he is saying so, and he's contradicting what they are saying, it could possibly be to barriers in information delivery at the facility level. We want to hear much more on this particular developing story. This is quite, one that we all must follow. Dr. Chiahini has joined us now, this time around via phone. Doc, I'm grateful to you for joining us. Now, we understand that the persons living with HIV are now being given 1 month instead of 3 months. Now, what are your checks on the ground telling you, and where are you getting this information from, sir?
Yeah, thank you. Hello, can you hear me?
Yes, clearly.
Okay. Yes, when the information LC earlier interview gave the indication that medicines are being rationed, I contacted her for further information to enable me assess the information I have. But up to now, I haven't received it. But I have also heard her explanation. Yes, it may be true that some facilities are giving medicines less than the 6 months or 3 months allocation. But that is not to say that we have run out of medicine, because when some facilities don't have medicines, they have to go for their allocation from the medical store. And if they haven't been able to do that, often they would ration the medicine. And so I think LC understands these issues very well. And so when there is rationing, it doesn't necessarily mean there is shortage. So I needed to clarify that. And when these matters come to the attention of the National AIDS Control Program or Ghana Health Service, they have arrangement of making sure that the pipeline is filled up so that they can get the facilities can supply the required amount of medicines to the client.
Doc, assuming that is the case, that maybe they have to go for more supplies, how long should this persist? Because according to Madam Elsie, this situation is from last month, which is February. We are in March. How long should it take facilities to restock?
Well, I am not aware of that. But our role is to make sure that the HIV response is well coordinated. And so if there is conflicting information going around, we have a duty to establish the facts and ensure that the correct thing is done. So my team will be working on this for us to actually understand what is happening on the ground and respond accordingly. But I need to clarify that no antiretroviral medicines are missing in this country. What actually happened was that the Global Fund and the Ministry of Health agreed that the supply that Global Fund gave us would, run out by May this year. And so government supplies should fill the gap so that we will not run out of stock. And government, therefore, took the necessary action, and here I mean Ministry of Health, to procure the medicine. Now, this medicine in October, and it was expected that the first delivery should happen in December or something like that. Now, the deliveries have not happened since that time. But that is not to say that the medicines are nowhere to be found or they are missing or cannot be accounted for. The simple thing is that the deliveries have not been done. And we expect that the deliveries will be done in the near future. And I know that the ministry is prioritizing that transaction and making sure that the deliveries are done before May. But
Doc, if you say that delivery has not happened, yeah, fair enough. But why hasn't it happened? Because you said the delivery was supposed to have been done in December. We've crossed January, we've crossed February, we're in March. It hasn't happened. Any reason why it hasn't been effected?
Well, we now understand why it has not been done. Contracts have been signed, that's my understanding, by the ministry and the suppliers. But the suppliers have not delivered, on their side of the contractual arrangement. And so it is a matter of the ministry ensuring that the suppliers actually live up to their side of the agreement. Now, it is important to point out that the issue of antiretroviral are very concerning for us because the life of the people living with HIV is dependent on the availability and use of these medicines. Their sustenance is solely dependent on these medicines. And so we will not do anything to undermine to do anything that would put persons living with HIV at risk by denying them access to antiretroviral medicine. And so when these matters come up in the media, when the facts are not clear, it worries us quite a lot because we create anxiety among the people living with HIV. And so that is the caution I always, want our stakeholders, especially NAPLAS, to be aware of.
Okay.
I know they are doing the best they can, and they are acting upon the information that they may have. but the way we present the information is also very important. And it is incumbent on me and my team to ensure that the Ministry of Health and other stakeholders, get the medicines into the country. And we are working on it. Since Friday, every day I am in touch with the Ministry of Health trying to check the status.
Okay.
And so there is I believe that we will definitely have the medicines. But even when if the medicines do not arrive by May, we still will have medicines that every person living with HIV would have access to.
Where will these medicines be coming from? Because Global Fund, according to you, say theirs will run out by May this year. And if ours does not come in, where are we going to get the ARVs for them?
No, we have at least 6 months stock. And so there will be medicines available for the client.
But you say you have 6 months stock. But here's the case: the persons living with HIV are saying that when they go to the facilities, they are being given a month instead of at least 3 months that you even told us earlier. Now, if persons with HIV must receive between 3 to 6 months of medication, how is it possible that people are receiving one when you are telling us now that you have at least 6 months of supply there?
I have already explained to you that the facilities that do not have enough have to request, and they have a way of requesting and receiving their stock. And so that is what they need to do in order to fill the supply gap in those facilities.
Okay.
So once they request, they will have the quantities that they require.
Okay. So it means that someone is not putting in a request because from last month, by now they should have rectified that, but that has not been rectified. So is it the case that some facilities are not really doing the work that they need to be doing?
Yes, I won't put it that way, but I just want to say that facilities that do not have enough stock must make their request and ensure that they receive, replenishment as quickly as possible.
Okay. All right. But finally, before I let you go, who are the suppliers of these ARVs and where are they?
Come again, please.
Who are the suppliers of these ARVs? The ones that we've signed a contract with, worth $80 million. Who are these suppliers?
I am not in the position to disclose their name.
Okay.
But what I know is that the Ministry of Health signed contracts with these suppliers.
Okay. All right. Doc, I'm grateful to you for joining us here and helping us with some information. Dr. Chemetua Hene is the Director General for the Ghana AIDS Commission. This is still the pulse here